Okay, let's unpack this. For a long time, diabetes was often seen as something relatively straightforward, a blood sugar issue, maybe a couple of types. But if you look at the numbers and really dive into the latest research, it's anything but simple.
Yeah, what's fascinating here is just how pervasive and, well, multifaceted diabetes has become. The materials you've shared highlight that this isn't just a physical condition. It's a global phenomenon.
Yeah.
Deep historical roots, amazing science, and this profound, often unseen impact on mental well-being.
So today, we're taking that deep dive into diabetes, far beyond just the basics. We'll explore its many forms, the classic types, sure, but also rarer genetic conditions. We'll look at the incredible scientific advances, current treatments, future possibilities, and a crucial, often overlooked aspect. Its complex relationship, a two-way street, really, with mental health. Our mission, to give you a shortcut to being truly well-informed about this pervasive condition.
Exactly. We'll try to connect the dots. From those ancient observations all the way to, future projections, helping you understand not just what diabetes is, but why it matters so much and what the future might hold for people living with it.
So let's start with what diabetes actually is. At its core, it's a group of endocrine diseases, right? All characterized by persistently high blood sugar.
That's the crux of it. And it happens for one of two main reasons. Either the pancreas isn't producing enough insulin,
Which is the hormone that helps sugar get into your cells for energy.
precisely, or the body cells simply become resistant to insulin's effects. They don't respond like they should.
Okay. And what are some of those early sort of classic warning signs someone might notice?
Yes, there are some telltale signs, often grouped as the three Ps. Excessive thirst, that's polydipsia, frequent urination, polyuria, and intense hunger, polyphagia.
Thirst, urination, hunger. Got it.
Yeah. And along with those, you might see unexplained weight loss, maybe blurred vision. It's basically the body signaling that it can't get that glucose into the cells for energy properly.
Those are clear indicators for an individual. But if we zoom out, the global scale, the numbers are just, wow. Beyond the individual suffering, what's the core insight here? What does this mean globally?
Well, the key insight, I think, is that diabetes isn't just a health crisis. It's an escalating global economic and social crisis, too. The numbers have just exploded from maybe 200 million people back in 1990 to an estimated 830 million by 2022.
830 million, that's huge.
It is. And think about the impact. Around 4.2 million deaths annually linked to it. And the cost, an estimated 760 billion US dollars in healthcare costs each year. This is fundamentally reshaping public health priorities, and it hits disadvantaged communities harder, worsening existing disparities. It's massive.
And here's a fascinating historical detail I came across. You won't believe this. Diabetes was actually described way back, like 1500 BCE, in Egyptian manuscripts. They noted two great emptying of the urine.
Wow, 1500 BCE.
Yeah. And the term diabetes, which means to pass through, that was used by Apollonius of Memphis around 230 BCE. But get this, the mellitus part, meaning honey sweet, that wasn't added until 1675 by Thomas Willis, after he actually tasted the urine of patients to confirm it was sweet.
Yeah, he tasted it. Okay, that's dedication or
Really,
something.
talk about dedication and maybe a strong stomach. So from those ancient observations to today, clearly a long history. But now it's not just one condition, is it? How do we differentiate what we're dealing with?
Exactly. That history helps, but yeah, diabetes isn't monolithic. It presents in several distinct forms, different causes, different pathways. The two big ones everyone knows are type 1 and type 2.
Okay.
Type 1 is autoimmune. Basically, the body's own immune system gets confused and attacks the insulin-producing cells, the beta cells in the pancreas.
So it destroys its own insulin factory.
Pretty much, leading to severe insulin deficiency. It often shows up in kids or young adults, under 20 usually, but honestly, it can happen at any age. There's even LADA, latent autoimmune diabetes of adults, sometimes called type 1.5.
Right. And type 2, which is way more common, works differently.
That's right. Type 2 is over 95% of all cases. Here, the main issue initially is insulin resistance. The body's cells start to ignore the insulin signal. Like the key is there, but the lock is rusty, won't open properly for the sugar to get in.
So the sugar builds up outside the cells.
Exactly. And often, combined with that resistance, the pancreas eventually just can't keep up producing enough extra insulin to compensate. Key risk factors, often lifestyle related, obesity, not enough physical activity, diets high in processed stuff, sugary drinks.
The typical Western diet profile sometimes.
Yeah, that plays a role. Even things like stress, genetics, family history, non-alcoholic fatty liver disease. Even adverse childhood experiences can increase risk. It's complex.
So it's clear diabetes is far from just one thing. What's the most important takeaway for you, for our listeners, about all these different forms?
I think the critical insight is that personalized medicine is just paramount. You
Yeah.
can't treat diabetes generically and expect the best results. Recognizing these distinct forms, type 1, type 2, and others, is really the only way to tailor care effectively.
Makes sense.
And beyond those two, there are other important types. Gestational diabetes, for example, occurs during pregnancy, maybe 2–10% of pregnancies.
Okay.
It often goes away after the baby is born, but it's a major red flag. It significantly boosts the mother's risk, like 10 times higher, of developing type 2 later on, and it poses risks for the baby too.
Wow, 10 times. That's a strong link. What about some of the rarer ones?
Well, there's MODY, maturity onset diabetes of the young. That's a rare inherited form. Specific single gene mutations mess with insulin production. Often these types can actually be managed without insulin injections.
Interesting.
And we're seeing more recognition of malnutrition-related diabetes, or type 5. Here you get decreased insulin production linked to severe malnutrition, but crucially without the dangerous ketone buildup you see in untreated type 1.
So different mechanism again.
Different again. And then there are other rarer causes damage to the pancreas from things like chronic pancreatitis or cystic fibrosis, certain hormone disorders, even some infections or drugs like glucocorticoids. It's a wide spectrum.
Okay, so we've really unpacked the many different faces of diabetes. It's incredibly diverse. But what happens when these distinct forms aren't identified early or aren't managed effectively? What's the long-term cost to the body?
That's where the silent damage really starts to accumulate. Uncontrolled high blood sugar, regardless of the type of diabetes, can systematically damage the body. It primarily affects blood vessels, both the big ones and the tiny ones.
Okay, so macro and microvascular.
Exactly. On the macrovascular side, the big vessels diabetes basically doubles the risk of cardiovascular disease, heart attacks, strokes. In fact, about 75% of deaths in people with diabetes are due to coronary artery disease. It also bumps up the risk of peripheral artery disease, problems in the leg arteries,
A huge impact on heart health and the smaller vessels.
the microvascular complications. That's damage to the tiny capillaries. This hits the eyes, kidneys, and nerves hard. Eyes. Diabetic retinopathy. It's the leading cause of blindness in working-age adults. Plus, higher risk of cataracts, glaucoma.
Blindness, that's devastating.
It is. Kidneys. Diabetic nephropathy, a major cause of chronic kidney disease, responsible for a huge percentage of patients needing dialysis in the U.S. And nerves. Diabetic neuropathy. This can cause numbness, tingling, pain, but also affect autonomic functions, and it leads to diabetic foot problems,
Yeah.
ulcers, infections, which sadly are the most common reason for non-traumatic lower limb amputations.
Amputations, just awful consequences.
Yeah. And it doesn't stop there. Increased risk of hearing loss, gallstones in type 2, cognitive decline, even a greater risk of dementia, especially if diabetes starts earlier in life. Increased falls in older adults, more susceptible to infections too.
And briefly, you also have those acute emergencies, right? Things that need immediate attention.
Absolutely. Things like DKA diabetic ketoacidosis, where the body breaks down fat too quickly, producing harmful acids called ketones, usually more common in type 1. There's also HHS hyperosmolar, hyperglycemic state, more typical in type 2, characterized by extreme high blood sugar and dehydration. And on the flip side, hypoglycemia, dangerously low blood sugar, which is often a recognized complication of insulin treatment itself, all require urgent medical care.
Okay, so the risks are clear and serious, but the good news, you said, is that with active participation, a comprehensive approach, it can be managed effectively to reduce these complications. So what are the main strategies?
Absolutely. Management is key, and it really starts with significant lifestyle changes. That means education first, understanding your condition, then dietary adjustments. There's no single diabetes diet, but healthy patterns are crucial. Think Mediterranean, low-carb, DSH diets, rich in whole grains, fiber, good fats. Limiting sugary drinks, red meat is important.
Right, diet and
And regular physical activity, super important. More than 90 minutes a day can cut risks significantly. Weight loss is often critical, especially for type 2. It can even prevent prediabetes from progressing or lead to remission in some type 2 cases. And of course, quitting smoking is vital for cardiovascular health.
Okay, lifestyle is foundational. Beyond that, what about medications? For type 2 primarily, and obviously type 1 needs insulin, right?
Correct. For type 1, insulin replacement therapy is non-negotiable, often using what's called a basal bolus regimen, a long-acting insulin for background needs, and rapid-acting insulin for meals. Mimics the body's natural pattern.
Okay, and type 2?
For type 2, it often starts with oral medications. Metformin is generally the first-line choice. It works mainly by decreasing the liver's glucose production and helping tissues use glucose better. But there are many other classes now. Sulfonylureas, which help the pancreas release more insulin, alpha-glucosidase inhibitors like acarbose, slow down carb digestion, DPP-4 inhibitors like sitagliptin, thiazolidinediones, and newer ones like SGLT2 inhibitors, which help the kidneys pee out excess sugar.
Lots of options then, tailored to the individual.
Exactly. And sometimes people with type 2 eventually need insulin too if their pancreas function declines over time.
That makes sense. And I imagine controlling blood pressure is also a massive piece of the puzzle here.
Oh, critical. Absolutely critical. Blood pressure lowering meds, especially classes called ACE inhibitors and ARBs, are crucial, not just because they lower blood pressure, but they have a specific protective effect on the kidneys, which, as we said, are really vulnerable. The target is usually below 490 milliliter Hg, though there's some debate about pushing it even lower for certain people.
Kidney protection, key point.
Yeah.
What about surgical options? Are those ever considered?
Yes, in specific situations, bariatric surgery, weight loss surgery can be highly effective for obese patients with type 2 diabetes. Often leads to remission, which is remarkable.
Remission even. Wow.
Yeah, it's a major intervention, but the impact on diabetes can be profound. For severe type 1 cases, especially if the kidneys have failed, pancreas transplants are sometimes an option, maybe combined with a kidney transplant, though donor availability is a big limitation. And there's even nerve decompression surgery for some types of diabetic neuropathy pain. But ultimately, effective management always comes back to the patient being educated and involved, working with a healthcare team. Self-management is key. Tools like social prescribing, home telehealth are also emerging to help support people.
Right. Okay, let's pivot to the future. The really cutting-edge stuff. The pace of innovation sounds incredible. You mentioned promising avenues. What's the biggest wow moment for you when you look at these emerging technologies and treatments?
A wow moment. For me, it's probably the whole concept of the artificial pancreas, or closed-loop system, as it's often called. This basically integrates a continuous glucose monitor, a smart algorithm, and an insulin pump, sometimes even a glucagon pump too, to automatically manage blood sugar levels 24/7.
Like fully automated.
Getting closer and closer. Components are already widely used, and the algorithms are getting smarter. Fully closed-loop systems are becoming much more feasible. And think about other tech. Things like smart tattoo vital sensors being researched. Imagine real-time glucose monitoring without constant finger pricks. That's the kind of innovation that could be transformative.
That sounds incredibly liberating for patients, yeah. What about biological solutions? Fixing the root cause in type 1, maybe?
Exactly. That's the dream for type 1. Biological solutions aim to replace those damaged beta cells, or maybe even the whole pancreas. Whole pancreas transplants, as I said, are limited. But islet cell transplants, transplanting just the insulin-producing cells, are improving. Big challenges there are donor shortages and preventing the body from rejecting the new cells or the autoimmune attack returning. But there's fascinating work using stem cells, coaxing them to become functional, insulin-producing beta cells in the lab, or even reprogramming other cell types. Huge potential there.
Stem cells. Incredible potential. And on the pharmaceutical side, are we seeing entirely new types of drugs beyond just improving existing mechanisms?
Absolutely. Especially for type 2, we expect more targeted drugs, maybe simpler regimens. But the approaches are evolving too.
Yeah.
One really interesting area is the brain-gut axis. Therapies targeting the central nervous system. There's a drug, quick-release bromocriptine, a dopamine agonist, which seems to help reset metabolic control in the brain. It suggests the brain plays a much bigger role in metabolism and insulin resistance than we perhaps thought. Maybe like resetting a thermostat.
The brain controlling blood sugar. Fascinating.
Yeah. And another really exciting avenue is research into drugs that mimic the effects of caloric restriction without the, restrictive diet. They often work by activating a key enzyme called AMP-activated protein kinase, or AMPK. You would think of AMPK as like the cell's master energy switch.
And that's a switch.
Yeah, it senses low energy levels and flips switches to boost energy production and efficiency. Metformin actually already does this to some extent. But new, highly specific AMPK activators are being developed. They could offer significant metabolic benefits, improving insulin sensitivity, promoting fat burning potentially, without needing drastic lifestyle changes for everyone.
So it sounds like the future isn't just about managing blood sugar moment to moment, but actively preventing that long-term damage we talked about from ever taking hold.
Precisely. That's a huge goal. Future prevention strategies are getting much more specific. targeting the actual biochemical pathways that high glucose triggers, things like osmotic stress, oxidative damage, the buildup of harmful stuff called advanced glycation end products, or AGEs, and targeting chronic inflammation too, which we now know plays a big role in insulin resistance and complications. Anti-inflammatory drugs are being explored. Ultimately, the hope is for truly personalized medicine, using your genetic profile to predict your risk of specific complications and tailoring preventative drugs just for you. Complication prevention drugs, essentially.
That leads us perfectly into another critical area, one that's often maybe hidden or not talked about enough. Beyond the physical, there's this powerful, often silent battle. Many individuals with diabetes face the significant impact on their mental health.
Oh, absolutely. This is such a vital piece of the puzzle, and it's definitely a two-way street. The relationship is bidirectional. People with diabetes have a much higher risk for mental health issues, stress, anxiety. The prevalence of anxiety might be as high as 18 to 40% in some studies.
40%. Wow.
And depression affects roughly 30%. That's significantly higher than the general population. And conversely, poor mental health, depression, anxiety, burnout can severely sabotage diabetes management. It makes sticking to the plan so much harder, creating this vicious cycle.
You can absolutely see how the sheer constant vigilance required, monitoring blood sugar multiple times a day, carefully planning meals, calculating insulin doses, managing medications, it must lead to immense psychological stress, feeling overwhelmed. That phenomenon people call diabetes burnout, it sounds exhausting.
It is exhausting. And add to that the constant low-level hum of fear about complications, worrying about potential kidney failure or losing eyesight or amputation. That creates persistent anxiety about the future. It takes a real toll.
And are there biological reasons why diabetes itself might affect mental health beyond just the stress of managing it?
Yes, definitely. The underpinnings are both biological and psychosocial. Biologically, we know that chronic hyperglycemia, high blood sugar over time, can actually alter brain structure and function. It can impact cognition, emotional regulation. We see links to chronic inflammation, higher levels of inflammatory markers like IL-6 and TNF-alpha circulating, which can affect the brain. There are changes in neurohormones like dysregulation of the HPA axis, the body's stress response system, altered cortisol levels, reduced levels of BDNF, which is like fertilizer for brain cells.
So the diabetes itself is creating a physically stressful environment for the brain.
Essentially, yes. It impacts brain regions involved in mood and thinking, like the prefrontal cortex and hippocampus. There are genetic and epigenetic factors involved too. It's complex. And then you layer on the psychosocial factors. Social isolation, maybe feeling different. Socioeconomic disparities play a huge role. We know racial and ethnic minorities, lower income communities often bear a disproportionate burden of both diabetes and mental health challenges. Unemployment due to complications like neuropathy. And unhealthy coping mechanisms, overeating, skipping medications, neglecting self-care, often arise from these mental health struggles, making both conditions worse.
It paints a really challenging picture. So what can actually be done? How can we support both physical and mental well-being when they're so tightly intertwined?
Yeah, the key has to be a holistic, integrated approach. Healthcare providers really need to make mental health screening a routine part of diabetes care. Just asking the questions. Psychotherapeutic approaches show real promise. Things like cognitive behavioral therapy, CBT, can help people develop coping strategies for both the diabetes management burden and the associated anxiety or depression. Mindfulness-based stress reduction, MBSR, also seems helpful.
So therapy and mindfulness can make a difference.
Definitely. And patient education needs to include the mental health aspect. Social support is huge, connecting with others who understand through support groups, establishing routines that incorporate physical activity, which we know benefits both mood and blood sugar. And sometimes pharmacological interventions for the mental health side are needed, antidepressants or anti-anxiety meds. Interestingly, some anti-diabetic medications themselves, like certain GLP-1 agonists and SGLT2 inhibitors, seem to have positive effects on mood and mental well-being too, beyond just blood sugar control. That opens up really interesting possibilities for integrated treatment.
That's fascinating. Okay, we've really covered a lot of ground today. We've journeyed from that historical understanding of honey urine, quite literally,
Yeah.
all the way to the cutting edge of an artificial pancreas, and from the deep cellular biology to this really complex interplay with our mental well-being.
It really does highlight it, doesn't it? Diabetes is just so much more than a number on a glucose meter. It's a condition that absolutely demands a comprehensive, integrated approach, recognizing that huge impact on both body and mind, and acknowledging the significant disparities, how it affects different people differently.
So, as we wrap up, considering how far science has come and the path still ahead, It kind of raises an important question, I think. In a world where, let's face it, modern lifestyles often seem to naturally push us towards conditions like type 2 diabetes, and where the mental burden of managing any chronic illness is just immense, can we truly cure it in the traditional sense? Or is the future of health going to be more about continually adapting? Adapting our biology with new tech and meds, adapting our minds and our societies to live well within these new health realities. Something to chew on until next time.